Hello everyone. So today our case of discussion is case number 679 of medicine. A 45-year-old asymptomatic man present for a routine physical exam. A grade 2 diastolic murmur is auscultated. He has no other abnormalities and ECG and chest X-ray are normal. What is the next best step for evaluating his murmur? So basically we have to choose the next best step in this case. Option are A option cardiac CT, B option cardiac MRI, Charlie carotid ultrasound, delta echocardiogram, or E option no further workup is required. So I'm going to give you 5 seconds so you can think about that. Yes, you are correct. The answer is echocardiogram. Option number D. So let's discuss why this is our answer. Our answer is echocardiogram in this case. Why this is the answer? Because in this patient, we are having a diastolic murmur, and you know that diastolic murmur are always pathological, and they always need further evaluation for assessing the type of abnormality in this patient. Echocardiography is the best initial test to assess the valvular abnormalities. So we have to this test will tell us what kind of abnormality this patient is having. Either it is aortic regurgitation or mitral stenosis, what kind of this abnormality is. And further, we discuss why not the other options are correct one. So cardiac CT is not preferred here because it is used in coronary artery diseases like a patient present with atypical chest pain and having risk factor. So it is basically used in coronary artery disease where we classify the calcification levels. So we do this test, and cardiac MRI is used for detailed cardiac structures and function, especially if the echocardiogram is inconclusive. And carotid ultrasound when we do is when the patient is presenting with stroke-like symptoms, transient ischemic stroke-like symptoms are present, then we will do carotid ultrasound, and no further evaluation or workup is indicated if the murmur is innocent murmur. uh, this is categorized by grading and also the type of murmur, either it is diastolic or the systolic. Remember, this patient is having grade 2 diastolic murmur, and diastolic murmur are always pathological. Remember that. If the patient was with the state of systolic murmur and the grade was 1 or 2, then the option will be no further workup required. Okay, so here the problem is not the grading is correctly defined by the no further workup, but the type of murmur is diastolic, so we did echocardiography. So if the murmur is so soft, then no further workup required. If systolic murmur, then no further workup is required, or positional or no symptoms, then we will choose this option. Further, some important note that you have to remember that I already talked with you. Most murmur are mid-systolic and soft grade 1 and 2. Remember, mid-systolic, not diastolic. If the patient is asymptomatic children or young athlete without any sign of heart diseases, these murmur are usually benign. Echocardiography is generally not required. So remember that if the patient is presenting without any symptom, he has mid-systolic or systolic type of murmur and it is soft grade 1 or 2, then we will not do any further evaluation. These were benign murmur. Other than that, if the patient is presenting with these two conditions, then we require further evaluation either by two-dimensional or Doppler echocardiography. So the indication are number one, loud systolic murmur, grade 3 and up to the grade 6, and especially hollow systolic or late systolic murmur. So mid systolic one are benign, and if patient has loud on the scale of grading or having hollow systolic or late systolic, then we will evaluate this patient. And number two, diastolic or continuous murmur. So our patient is having this condition diastolic memory regardless of grade. I hope this video help you, and for further questions like that you have to follow my channel Sword of Knowledge. Thank you so much for your attention.